Congratulations, you're going to be a mother. That feeling of excitement and uncertainty when you first saw the double line, the first 3 months of pregnancy or the first trimester, is a very critical period when your baby's organs develop rapidly, which is miraculous, but can also be exhausting. As your body undergoes many changes, let's find answers together to the questions that arise in your mind, such as, are these normal, in light of scientific research? Between 70 and 85% of women experience nausea during early pregnancy, and about half experience vomiting. So how can you cope with these difficult mornings? Studies show that consuming ginger and wearing acupressure bands on the wrist can alleviate symptoms without any side effects. Vitamin B6, pyridoxine, has also been proven to be quite effective in reducing the severity of nausea. If your symptoms are unbearable, your doctor may prescribe safe anti-nausea medication. However, keep in mind that these medications may cause drowsiness. One of the biggest heroes of this period is folic acid. Taking 400 micrograms of folic acid daily is strongly recommended from the planning stage onwards to support the baby's brain and spinal cord development. Regular folic acid use not only protects the baby, it also prevents pregnancy anemia, and the need for blood transfusions by raising hemoglobin levels in mothers. In fact, studies show that babies of mothers who take folic acid supplements have significantly lower rates of admission to the neonatal intensive care unit. When you reach weeks 11 and 13 of your pregnancy, a very important checkup awaits you. Thanks to the detailed assessment of the mother and baby during these weeks, risks such as preeclampsia, pregnancy poisoning, premature birth, and fetal growth restriction can be detected very early. Low-dose aspirin therapy, started immediately in high-risk pregnant women, can prevent approximately 90% of early preeclampsia cases. We now have a much more powerful tool for genetic screening, NIPT. The NIPT test, which examines the baby's DNA from a simple blood sample taken from the mother, detects abnormalities at a rate 20% higher than traditional methods and reduces the need for invasive testing, amniocentesis, which carries a risk of miscarriage by 45%. Most people know that gestational diabetes is tested after the 24th week. However, the medical world is changing this approach. Recent evidence emphasizes that the foundations of gestational diabetes are laid before pregnancy and can be detected much earlier than the 14th week, namely in the first trimester. Gestational diabetes diagnosed and managed early on significantly reduces the risk of diabetes and heart disease for both mother and baby, both during pregnancy and in later years. Spotting and bleeding during the first 3 months can be very frightening for expectant mothers. Your doctor may detect an area of bleeding around the sac, called an intrauterine hematoma, on an ultrasound. This condition requires close monitoring by your doctor, as it can increase the risk of miscarriage, premature birth, fetal growth restriction, and placental abruption. However, rest assured that hematomas have no connection to preeclampsia, pregnancy-induced hypertension. Also, you may not be able to hear your baby's heartbeat immediately on an ultrasound in the very early weeks. According to current medical guidelines, not seeing a heartbeat before the embryo reaches 7 millimeters in length, CRL, does not necessarily mean a pregnancy loss. It is only suspicious, and it is necessary to wait a few more days for a definitive diagnosis. What if you get an infection during this sensitive period? Refusing treatment by saying, "I'm pregnant, I must never take medication," is a big mistake. If urinary tract or respiratory tract infections are left untreated, they can cause premature birth or miscarriage, harming the baby much more than the medication would. Certain groups of antibiotics, such as penicillins and cephalosporins, are considered safe during the first trimester. However, antibiotics from the tetracycline or fluoroquinolone groups should be avoided at all costs, as they can affect the baby's skeletal and cartilage structure. Be sure to consult your doctor when you get sick, and don't hesitate to get the treatment that's best for you. Remember, right now, your body is building a unique and miraculous living space for your baby. Behind every challenge you face lies an incredible mechanism protecting your baby. You can share all your questions about the process with your doctor and with us in the comments section below. Don't forget to subscribe and like our video to stay updated on new videos that will guide you on this journey. Stay healthy and peaceful.